We are reporting for 4 reporting periods since we last reported out on Friday. And between Friday and Saturday, we had 170 new cases diagnosed. Between Saturday and Sunday, an additional 159 new cases. Sunday to Monday, 119 cases, and Monday to today, 101. That is a total of 549 cases over the past 4 days, including 5 epidemiologically linked cases, bringing our total in British Columbia to 10,734. I do want to note that this was, as you know, a long weekend, and there had been some accumulation of tests that we'll talk about in a minute. That includes, our total includes 3,892 people in Vancouver Coastal Health, 5,595 people in the Fraser Health Region, 235 in the Vancouver Island Health Region, 582 people in the Interior Health Region, 341 people in Northern Health, and 89 people who normally reside outside of Canada. We currently have 1,476 active cases, of whom 77 are in hospital, 24 of whom are now in critical care or ICU. Sadly, we've had 5 additional deaths over this long weekend, 2 in the Fraser Health Region and 3 in the Vancouver Coastal Health Region, bringing the total number of people who've died from COVID-19 in British Columbia to 250. And our condolences go out to the families and the care providers and the communities of these 5 people who died at a time when it is so challenging for us to come together and to mourn and to remember. We have 3,618 people currently under active public health monitoring and 8,974 people who are now recovered. We have 4 new healthcare outbreaks to report over the past 4 days. The PICS Assisted Living Facility, Chartwell Charrington House Assisted Living Facility, Yaletown House Long-Term Care Facility, and the Weinberg Residence Multi-Level Care Facility. And those are all being posted on the website. In addition, we have 2 outbreaks have now been declared over at the Evergreen Hamlets and at Charrington Place. That leaves us with 20 active outbreaks in our healthcare system, 17 in long-term care and assisted living, and 3 in acute care. And we're up to 919 people who have been affected in long-term care, 533 residents, and 386 staff. While we have no new community outbreaks to report, there are continuing to be community exposure events, and those again are posted both on websites and on the Health Authority websites and the BC CDC website. I'd like to speak for a moment about the higher case numbers we saw over this weekend. Firstly, of course, that it was over a 4-day period than our usual 3-day weekend reporting period. But the numbers are higher than what we would like to see, and on average are higher than what we were seeing in the past week. But it is important to look at them in context. As we know, our lab teams are working to process as many tests as positive as we've increased our numbers over the past week. And as there were a number of events that conspired so that at the end of last week there was a bit of a backlog, and those were cleared over the weekend. And the team at particularly at the BC CDC, but at a number of our other partner labs, processed essentially an extra day's worth of tests, about 6,000 tests, to clear that backlog that had emerged. And these were primarily in the Fraser Health Region, and we see that in the numbers that have been, that we see are positive in the Fraser Health Region as well. These tests identified new community cases and exposures, which tells us again that our testing strategy is working and that the backlog has now been cleared, and we are working to make sure it stays that way. We are finding people who are positive with COVID-19. And while clearing the backlog meant an increase in the overall number of confirmed cases, the active cases and the percent that are positive remain stable. We continue to be under 2%. And over the past weekend, it was 1.39% of the tests that were done were positive across British Columbia. Despite the thousands of people getting tested, 39,170 tests from October 10th to 12th, our positivity rate remained, as I mentioned, at 1.39%. And this is where we want to be. We want to be able to be picking up those cases in the community and make sure that we are doing contact tracing on every single one. We are also, however, working on a province-wide plan to ensure that our testing system is operating as efficiently as it can be, and that includes, as we talked about last week, there are several different platforms that are in use across the province, and there's a pre-test piece which has had some challenges in terms of booking a test, getting in for a test. There's the processing piece, and we are at the mercy of certain shortages worldwide on reagents and things like that. And also there's the post-test reporting out. And I look forward to sharing more information about how we're increasing the efficiency in all those areas in the coming weeks. While we haven't had any community outbreaks in the last couple week or so, we do continue to see community exposures, as you know. In large part, this is because we know that the symptoms of COVID-19 can take several days to develop, and for some people can be very mild. Recently, over the last weeks, we've seen an increase in community exposures connected to recreational sports like hockey and soccer as they've started slowly to restart. The result has been that some sports facilities have needed to close or to shut down for periods of time. We know that physical activity is important for our overall health, and from the beginning, we've encouraged people to go outside and to be active, and we know as well that it's incredibly important for young people and for our school-age children. As with many other activities that have restarted, these facilities, sports leagues, and recreational organizations needed to have a COVID-19 safety plan, and we've been working with the organizations to make sure that those are guided by public health principles to ensure that we can have a safe return to sport. And like the recent NHL playoffs, the plans have prioritized the players over the spectators. And I know that's a challenge for some people who want to be there to support their children in particular who are playing on teams. But we also know that spending time socializing or cheering with other parents and fans before, during, and following games increases risks of transmission and exposure for families. That's why there are restrictions on spectators in arenas and on sidelines of games. And it's important for all of us to think about our cumulative interactions. The more time we spend with others in one area means we have to be careful about spending less time in another area. If you're in a busy workplace, have children in school, then it is all the more important to limit your time with others on other, whether it's social events or recreational sports and other areas. As much as you may want to see the winning goal or celebrate that perfect pass after the game, we need to ensure we are keeping ourselves and our loved ones safe. And the best way to do that is to follow our COVID-19 safety basics on and off the field. I know most people are doing the right thing, but I ask that you keep this top of mind. It is important for us as communities across this province to keep our workplaces open, and essential that we keep our schools open for the health of our community and for the health of our children. This new normal is new, and it's new for all of us. But it is not forever. It is for now. And that means if you are playing in a sports league, pick one league. Don't pick multiple leagues. If your children are involved in activities after school, pare it down so that they're not exposed to large numbers of different groups of people at different days. Our actions today have a direct impact on how our province will fare tomorrow and in the weeks to come. And we know that we can do this. We have seen us flattening our curve again. We've kept our numbers in control, mostly through the work that we're doing together to keep our interaction safe, and the work that the public health teams are doing to follow up on individuals. Each day and month that you choose to do the right thing, you're helping to protect all of us. You're in keeping our important activities and places open and safe. And just as we did this past weekend, let's continue to find new ways to support each other and show we care at a safe distance. Please take a moment today to think about what you are doing and what you can do to make yourself and your family safe. Let's remember that we are stronger together by staying apart. And we will get through this by continuing to be kind with each other, to be calm, and to take that time to recognize that we all have our own reactions to how we are getting through this pandemic, and we all need to be safe.